Hello, Andrea. Hello, everybody of us. Very nice to have you because we'll start talking about male infertility. Andrea is a wonderful nurse that knows all about infertility, and she works a lot with those kinds of patients. Myself, I am an andrologist, so I take care of the men with infertility disease. And today we will talk each other about one thing that I think that is really very important. It's the style life that people must take care to have a better situation to become fathers. It is the first thing that we can do. When we have patients, partners, patients with infertility, one of the first things what we must do is to know what they are doing, how they live, if they have stress. What do you think about it, Andrea? I would like to know what's your opinion about these things.
I think it's such an important topic, Anna, because men are 50% of the equation when it comes to fertility. We always need sperm to have a baby. However, most of the treatment and the assessments are done on women. And so often I see men are left out of the journey. And so many times patients go ahead with invasive treatment without men seeing a specialist like you to see if there's something wrong.
Sure. That's always, it's happening always. And even sometimes they think that even the problem is not going with them.
Yeah.
And it is the first problem because, as you tell, 50% of the fertilization are spermatozoa. But I think that the most important thing is that we must think that behind the spermatozoa there is a man who lives in a society, who must take care of his diet, of sports. What do you think about it?
I think it's very important. Lifestyle and life habits in general, I think they play such an important part in the development of healthy sperm. And I think it's a way as well of giving the power back to couples. It empowers couples with something that they can do to have the active participants in their treatment. I'm interested, when we're talking about lifestyle and habits, what certain habits are we talking about that can make a difference in males' fertility?
I will tell you only one data that we have studied 3 years ago, that patient with high body weight have less quality of spermatozoa. They have an astenosperm, a loss of movement of the spermatozoa, and only changing the diet, taking care that they must lose the weight, 16% of them can improve the quality of the spermatozoa, the seminogram, the sperm analysis, the sperm screening, and even then can also have a natural fertilization. That is really the first thing that we must try to perform. Patient, first of all, must be studied, must be treated in the things that they can change. For example, they must eat a better quality of vegetable, fruits. That's really very important. Don't eat a lot of meat, hamburgers, fats, because those produce a lot of oxidative products that makes that the quality as the fertilization capacity of the spermatozoid are getting lost.
Is there a specific BMI, a specific weight that is ideal for male fertility?
Yes, imagine that now in our society, more than 70% of people have IMDM more higher than normally.
Yeah.
Because there is a lot of sugar in the food, a lot of fat in the food. So more or less 24 until 32 is the best situation. But really, it is very difficult to have it.
Yeah.
Because a lot of patients, a lot of men normally have more than 5 to 8 kilos, that the normal weight that they have. So when someone must lost weight, you must choose perfectly the kind of food that they must eat, because it's less difficult than to change their weight, because they need to have as soon as possible this condition, because a woman is older than before.
So when men start making these changes, and you mentioned that they need to eat vegetables, fruits, and avoid hamburgers, pizzas, all the fast foods that have so many trans fats. If men start making changes today, how soon can they notice a difference in their sperm?
There is something that everybody must know. When you have a stem cell of spermatozoa until becoming a spermatozoa, you need more or less 2.5 to 3 months.
Mm-hmm.
So we need more or less 6 months to note the changes in the sperm screening, and becoming until 9 months to have a baby or a fertilization, natural fertilization.
Okay, so we're looking at 2 months. So starting change today and then sticking to that diet.
Yes.
For at least 2.5 months to notice a change and a difference.
Yes, and I think that it must be very simple. No fast food, and good quality what you will eat. Low sugar, low fats. And it's another style of life that you must have. Because when you do this, then you can do sports. You can do exercise. One is giving the hand to the another side. And it is you improve the vascular circulation, so the testicle have less toxic products inside of them.
So I think now that people are mostly working from home, except at the clinic,
Yes.
It's also a good time because people can potentially cook from scratch, cook at home instead of ordering or eating something that they just buy off the shelf on the supermarket. So it's a great opportunity to embrace that new change and make it part of your daily life as well.
Yes, sure. But there is another problem. Here in Spain, people must stay a lot of time at home. So if they don't do exercise, they have a higher weight.
That's true. That's true. So we need to combine diet with exercise as well.
Yes.
And is there a type of exercise that is good or bad? Should they be aiming like practicing to run a marathon? Or what should they be aiming for?
They must protect their testicles. That's the most important thing, because there are some exercises that are that you can do something painful in it, and it's not good. The best thing is walking,
Yeah.
walking. That's the best thing. This is the best exercise that you can do, and it is when you make exercise, it is very addictive. Then you need to do it more, and then you try to eat better, then you change your style of life, and then you will live more years, that is sure. You will become father, and then you will live more time.
And I want to ask you a question that I get all the time, because usually women are the ones trying to make men adjust their diets, and women want men to make all these changes, which they don't always want to do. And one of those changes that they want men to do is to stop drinking alcohol. Is alcohol important?
Sure. This is not exactly a diet problem, is a social habit.
Yeah, that's
Smoking, alcohol, and drugs are the worst things that you can do when you are looking for a kid.
yeah.
And it is a very serious problem because it's a social activity. The good thing of the pandemic that you don't have a social life, so you can start in this time to change this habit, but really it is very, very important to take out. I am not talking about drinking a little glass of wine. That is antioxidative and it is really good.
Mm-hmm.
It's when you take so much alcohol, that's the problem, because it's become as a toxic effect, not only for having kids, for losing the quality of the movement of the spermatozoid, but you lose your erection. Then you start having an erectile dysfunction. And then you have a problem of ejaculation, a speed ejaculation, and then an anejaculation. It's affecting all around. And when we are talking about smoking cigars, it's even worse.
Yeah, I can say that for my husband, something that has helped us reduce alcohol has been ordering non-alcoholic beers. And we found a non-alcoholic wine as well, which is actually quite good because they make the wine normally, but then they remove the alcohol at the end of the process. So it still tastes like normal wine, but it doesn't have the alcohol. So I just wanted to say to everyone who is listening that there are alternatives out there so that you can still engage in that social activity when it becomes possible again. So you can have a glass of wine in your hand or a glass of beer in your hand, but not having alcohol in it, and might be a way to help you create that change that you need in order to become a dad.
Sure, sure. I think that we must use all kind of things that can change your style of life to becoming better. It is very important as a psychological situation. No?
Mm-hmm.
If you make exercise, if you make diet, you are working hard to become a better person, a better style life, a better society. And it is very important because if you want to become a father, a dad, and a man, you must show those things to your kid. It's an exercise to be prepared to be in the future a father and a mother.
Exactly. It's a change that it's not just for now, it's for life, because you
Yes.
are creating a better environment for your future children as well.
Yes, and I think that is very important what we are talking about it, because one of the most natural things that we have, because we are losing as human being, we are losing a lot of natural things. One of the last natural things that we have is to becoming fathers.
Yeah.
And then we must protect this situation. We must protect at the beginning. We are looking for them when we need doctors, nurses to help us to become fathers, and for the future. It's a very important responsibility, as we know that nowadays we are losing young people because the population are becoming older and older. So it is really very important what we are talking about now.
And Dr. Anna, we talked about the weight and people also not exercising enough, but have you found that then there's some men who exercise too much, and there's also those young men that take steroids, so they can build muscle. What is the impact of that on male fertility as well?
It is a tragedy. It's a very, very dangerous situation. And nowadays, every day every week, I see 2 or 3 persons with
Really?
different, yes, with the steroids. What they are happening? First of all, they have a lot of muscles, but they lost them, yes, muscle, but they lost their sexual capacity. They lost their libido. They are losing the weight and the size of the testicles, and they have a very great alteration of the hormones, higher prolactin, loss of testosterone, and then they have an azoospermia. Azoospermia is no spermatozoa in the sperm clinic. And it is a very serious problem because it is very addictive. People who start taking steroids to have muscles and muscles are very difficult to stop doing it.
Yeah.
And they need tap. The first thing that they must do is be helped by psychologists or nurses to stop using it. I have seen 2 persons, a woman crying because he doesn't want to stop doing steroids. And if they stop, they need 6 months to 9 months, even 1 year, to have again a good production of spermatozoa.
Yeah, so it can take a long time to recover from the damage.
Yes, more or less 3 to 5% of them, they will never recover their fertility situation. So it is very dangerous. And it is dangerous because now we are seeing young boys from 14, 16 or 17 years old that starting to take these steroids. And then that is a very great problem because they can stop their sperm production because they haven't finished their development. So it is really very dangerous. And by law, it's not allowed to use it like this.
Yeah, that's true. And I often find that women take a lot of supplements when trying to conceive. Are there any supplements that men should be taking?
I think that we must use those supplements that are really necessary. I don't think that it's good to take vitamins and all of the things because everybody says, oh, it's nothing, it's not bad. No, it's not good. If you have a good diet, you will have all the vitamins you will need. And then when you will be visited by the doctor, by an andrologist in this case, you must see if they have an oxidative alteration due of a lot of situation of way of life or even toxic products around us. Every day we have more and more chemical products that produce infertility in men. So you must choose those kind of supplements that can help in those patients.
So it's always best almost to test our blood levels first before we start taking anything because our blood levels might be normal.
Sure.
Or their blood level, men's blood levels might be normal.
Exactly. It's all the same thing as also in women. I will take those kind of, if you need it, okay, but if you don't need it, it's stupid to take it. You are losing it with the urine.
Yes.
I think that it's very important to take just what we need. And it is more important to change how you live instead of thinking that if you take those things, you will be better. That's not true. The reason that you have an infertility must be treated. So you will have more possibility to become a father or mother.
Do you often find that people read things online that aren't real, that aren't true, like fake news or habits that people change, but then they are not really things that matter when trying to conceive?
Sure, that's always happening. We are in the 21st century that you have internet at home.
Dr. Google.
Dr. Google, it's fantastic. I want to become Dr. Google. He didn't study anything. I have been studying during 10 years to have this experience, 30 years studying it. And he has a lot of fake news. That is true. That's why instead of do something directly through Dr. Google, better ask someone who works in a fertility center that can help you directly, and with it you can talk.
I've seen an advert online for this underwear that keeps the testicles cool. Do you think that's important? Is that something that men should be buying?
No, you must not frozen your testicle. No, but you must not hit them. Leave them alone slowly and they will work perfectly. But if you have too cold, you will have problems because it is really very painful. I have seen some patients that have read what you are telling just now. And they have, it's so cold, it's very, very, very painful. Yeah, sure, you are freezing your testicles. And the other side also is very dangerous. I have patients that go to the spa every day, to the sauna, only taking them out them from the sauna during 2 or 3 months, they recover their fertility situation. So natural things are the best things.
Yeah. So
don't do extraordinary things.
So sperm is sensitive to those high temperatures in the sauna, for example, or and men were using their laptops in their lab. That's also,
it is terrible.
Yeah,
it is terrible because it is very short radiation that can affect the testicles, and that it has been demonstrated in a study more or less 10 years ago with cell phones that can alter the movement of the spermatozoa. So laptops never over your testicles, don't frozen your testicle, don't hit them, and don't put your cell phone in the pocket in front and behind. No?
Yeah, so the phones as well, they shouldn't be putting them in the front pocket as well.
Exactly. Always behind. There are very simple things to do that can help, because normally male infertility, it's not only normally one reason, it's a lot of reasons, and if you can change little by little over them, you can improve having a pregnancy, a natural pregnancy, or better situation to have an IVF or reproductive techniques.
And do you find that those men that wear those very tight jeans, very tight trousers, skinny jeans, that's also not good because it keeps the testicles warm as well?
Exactly, and it's happening with people who have very weight, are very fat, no? Because they make a compression of the testicle, so it's not good, and it is painful. It is really very painful. So normally this kind of person comes to visit because they have pain in the testicles, and then when they make a sperm screening, you find that they have very low quantity and quality of the spermatozoa.
And men who work, for example, sitting for a long duration of time, either in an office or maybe driving, is that a problem that they're sitting for long periods of time?
Yes, because they compress the sperm artery. So it's becoming low quantity of good blood in the testicle. Normally, it is very difficult, and it's not good even for the health, as being not hours and hours sitting in front of a laptop or working driving. If you want to have a good quality of your job, normally it's good to stand up and 1 hour and a half or 2 hours, 10 minutes walking, and then you can continue. Sure.
That's a very good tip. And do you find that men who have very stressful jobs or very stressful situations in their lives, do you find that there is any relationship between stress and male fertility?
I believe that it can be, but there is no any kind of scientific study that can demonstrate it. And the reason is why men produce millions and millions of spermatozoa. It's not the same as the woman that have a very short cycle with only one oocyte. So it's very difficult to demonstrate it. What it happened with the stress in men, that they lost their erection, so they cannot have sexual relationships, they cannot do intercourse, so they lose the opportunity to have a fertilization, a natural fertilization.
Yeah, so that is something to consider as well, right? So if they can find strategies to reduce those stressful factors in their lives, then that can be also helpful as well, because then they will be able, so if we're stressful, we're not as prone to want to engage in any sexual activities.
Sure. The stress reduced. Now we know during this pandemic we'll make a study for 5,000 partners, and the frequency of intercourse is going very quickly down, and it's due of stress.
Yeah.
Brokers and persons that have a lot of responsibilities in the society have lower intercourses per week than people that doesn't have intercourse. And the World Organization Health says that at least we must have one per week, and you have less than one per week, you have a problem.
And I think for people who are stressed as well, when we're stressed, we tend to eat less healthy. So we tend to go for those high sugary, high fat.
Yes, fast
So
food.
Everything is sort of connected.
Sure, that's why the lifestyle is all of it. The society style also. And we must learn how to eat better, how to live better, how to control the stress. Job is important, but more important is your health. More important is around the people you want to be, family, parents, to have a good relationship. All because you will prepare a good future for the next generation.
And Dr. Anna, one last question to everyone who is watching us. If you could give them a tip, if they are trying to make these changes, what tip would you give? What advice?
The most important thing is that really they must be sure that they want to change, because you cannot do something when you are not really sure. So take your time to do it. Be sure that what you will change, it will be really better for you, and you will live better. Around you, people will stay better, and the future will become better because you will live more years. People who eat fast food, sugar, fat, have more or less 10 years less living than the one who take care of it. And even though they will don't have a lot of illness that will become very serious for them, heart attack and things like this.
So thinking about why we want to make the change, why is it important?
Yes.
And then making those tiny steps one at a time.
Yes. And then if you do these little steps, you will become very happy with oneself. No, I stopped smoking. That's fantastic. That's really very good. And then you start walking a little bit, no, 20 minutes every day. And one day you are saying, I am walking 1 year and a half, and 1 hour and a half, and I have lost already half kilos. And then I stopped eating bad food, and then you can show to when you will have your kids how to become better persons.
Brilliant. Dr. Anna, thank you so much. I think you triggered so many important aspects and questions, and I'm sure lots of people will find this webinar very, very useful.
And it has been fantastic to meet you, really.
Yes.
You have, you know exactly what really people needs, and you know how to ask me to have the response. I hope in the future we'll go we'll do more things.
We'll do it again, definitely.
Okay. Well, thank you very much. Nice to meet
Thank you.
you. Bye.
Bye.
Until the next time. Goodbye.